Let's dive into abdominal massage. Why do we want to massage our abdominal wall muscles? Well, just like any other area of our body, our muscles can get tight. And when our muscles get tight, they don't function as well. So we don't want to stack on strength onto tight muscles if we don't have to. So we want to work on massaging out our abdominal wall muscles so they can function to their optimal capacity. So how are we going to massage the abdominal wall? Let's lay on our back. And this is going to be if we have not had surgery recently. Make sure that you're cleared to be able to work on your abdominal wall. And what we're going to do is we're going to scan the tissue. So we're going to do these circular motions along the obliques that go from your pelvis here all the way up to your rib cage. They're in the front region here and in the back. But we're going to scan and just see where we might be tight. You can do kind of these circular motions. Be like, ooh, I'm kind of tight right there. We can go up the rectus abdominis, which is the muscles that go up from the pubic bone up to the rib cage. That's those six-pack muscles. And these ones often have trigger points for me, and they do for most of my patients that I work on. So I really want you to get in there and see where could those trigger points be. Do you feel a spot that feels more tender than another? Now I want you to note the depth that I'm pressing in. Can you see how deep I'm pressing into my abdominal wall? Well, when you're working on an area, like if I'm working on somewhere near my rib cage, I'm hitting bone. But this area of our body does not have bone until you hit your pelvis here, or if you were to go deep enough for your spine, which you wouldn't do for massage, you couldn't do that. But for this area, you'll see there's a lot of give. So to be able to really work on those muscles, you have to go to the point where you hit tension and then work. You can't just work out in this area here, this really soft pressure, or you're just gonna get more of that skin layer. So you're gonna go a little bit deeper when you're doing abdominal massage. With this, let's start with the obliques. So for the obliques, you can just do circles and press into that area. You can take a pincher hand, and when you do this, your thumb is gonna get into the back, and then your fingers are gonna be on the top and the front here. And you can just kind of go back and forth. You could do circles. You can also pin, and then drop your knees to the opposite side. So this is a pin and stretch. For the rectus abdominis, same thing. You can do those circles. Once you hit a trigger point, you can just hold and do work on that. And then there's another pin and stretch where we're going to strip the muscles. So we're going to go to the bottom of the rectus abdominis, just a little bit above the pubic bone. We're going to flatten our back into the ground. And then we're going to arch our back as we go up those six-pack muscles, up those muscles along the middle of the abdomen, which is the rectus abdominis. So we're going to flatten our back, pin the muscle, and then go up as we arch our back. Now, this is a lot better when we have oil on our stomach or lotion. The gliding just really allows you to get into those muscles. So we have our obliques we can work on, and we have our rectus abdominis. Now, last thing I want to share with you since we're working on the abdomen is that we can do some bowel massage to get our bowel movements and the colon really moving so that we're not constipated. So the colon goes up the right, across underneath our rib cage, and down the left. And I want you to think about the bottom part of the colon goes into the ileum here, this part of the pelvis, down and then out. So you can do bigger and a little bit deeper circular motions all the way up the right, across underneath the rib cage here, and then down the left into that ileum and down towards midline where that pubic bone is. You can repeat that several times to really get the colon stimulated to allow for the bowels to move. So again, we're doing abdominal massage to reduce any tension in our abdominal wall so that our abdominal wall can function optimally as we're working on strengthening it. We don't want to strengthen on top of a tight muscle. It's just not going to be as good as if we could get that muscle to not be as tight. So while we can stretch our abdominal wall in positions like cobra and leaning to the side, those are great, but this is another way we can work on the tension is abdominal massage.